Alright, channel, so we're going to be doing the usual that we usually do here. Well, obviously we usually do the usual, that makes a lot of sense.
I've lost track of left and right.
I actually never knew the difference to begin with, so it's amazing that I'm allowed to drive. So that's tender there. That's actually probably a title. Patient can't remember which glute was torn. Is that clickbaity? Guys, let me know in the comments. All the way out, relax the upper body. There we go. Nice. Art, good to see you today. Thanks for coming in. So Art and I have been friends for a while now, and he's finally in on the channel dealing with some lower back discomfort that's been aggravating since he started recently getting back in the gym. So we've good on him. We love that he's getting more active, but I'm going to let him talk about it a little bit more. So Art, why don't you share with us what you're dealing with right now?
Well, mostly want to do more like preventative maintenance, having been a powerlifter for years and gone through the ringer with injuries. Like I want to make sure I'm not at risk, and I guess really just keep things tuned up.
Really appreciate the preventative approach here. You said you were a powerlifter for years. Did you take a break?
I took a 1 year break.
Took a 1 year break, and with that, getting back into it, fortunately the foundation is laid. It's going to be easier for you to get back into it as compared to the first time, but you're smart to try to make sure that everything is working or moving properly before you just throw yourself at it, right? So, sorry, maybe I misunderstood. Are you dealing with any discomforts while you're squatting or working right now, or?
I don't know if it's like post-traumatic stress.
Okay.
Or
all right.
like,
Are we getting into childhood here? Like, what's
no,
no,
from like previous injuries and like old aggravations, like now that intensity's ramping up and the volume's in there, like you do start to feel those old nagging pains.
Okay, so and what are those pains? Where are they?
Mostly hips, low back.
Hips, low back. Glutes. So you mentioned, if you're okay sharing, that you have like a history of trauma specifically with the glutes, or?
Yeah, I tore my glute med.
Glute med. Okay.
And just like long term, like SI pain.
How long ago was that tear?
4 years.
4 years ago. Okay, and since then, like obviously you're able to get back to lifting now. You're able to get back to the sport to a degree.
Yeah.
Are you noticing that? Is it your left or your right glute?
Left.
It was your left glute. Okay. Are you noticing that the left glute you seem to be getting that pain on the left side as compared to the right, or?
No, it's mostly in the left side. You feel it in the hole, like when you're at the bottom of the squat coming back.
Got it. Okay. So we'll do a lumbar range of motion exam today, as well as a lower limb screening. A straight up muscle tear, that's a pretty serious injury, but it seems like you probably recovered at least to a moderate, if not large degree, which is really good news. But we'll screen for that too and see what we can do for you today, okay?
Cool.
Awesome. Any other concerns at all you want to talk about, or is that the one that we'll primarily focus on for now?
Yeah, let's see what's up.
Sounds good to me.
Yeah.
Awesome. Anytime we have a history of trauma to the glutes, the hips, the lower limb, it's prudent to do a neuro exam. It's prudent to do one, so let's go ahead and do that. I'm going to start off just with some quad reflexes here, and we had a larger one just a second. There we go. That's what we're looking for. Back here. I need that foot off the floor. Slide it a little bit further back for me. Thank you. And then relax the leg. Good. There we go. Good. Push this leg up into my hand as hard as you can. Good. Push this leg up as hard as you can. Nice. Lift the toe up. Good. Lift the toe up. Good. And this is the unfun one.
Oh, Jesus.
Yeah, people don't like that one at all, but that's the one that checks for the important stuff. So, but that's a normal lower limb exam. So, no concerns neurologically with Art, given the past history. Once again, we got to get into our range of motion exam now that we know that it's a lower limb complaint. So, I'll get you to bend forward, try to touch your toes for me as far as you can.
Am I allowed to bend the knees?
Yep. Well, try to keep the knees straight. Does that cause any discomfort or pain in the low back as you do that?
No.
No? All right, come back up the other way for me. Now I want you to bend backwards like so, like extend backwards. How's that in the low back and the glute region? Anything there at all?
Fine.
It's fine? Okay. I'm going to have to recheck the camera to look at the exact angles, but we seem to have a relatively pain-free range of motion lumbar spine, which is really, really good news. Getting started with the lumbar lower limb orthopedics exam, we're going to start with our gold standard of a straight leg raise. So I'm going to keep your knee straight. What I'm going to do is lift your leg straight up here. Do you get any discomfort in the glute, the low back, the hamstring with this?
Hammies are tight.
Hammies are tight. Okay, so we're able to get to about 45, maybe 50 degrees. Obviously, we'd want more range of motion. A normal range of motion for this is between 80 and 90, but the fact that we're not getting anything shooting, very good sign. We're going to slowly lower that down. Let's do the other side, bringing this straight up. Are you left or right leg dominant? Do you know? If you were to kick a soccer ball, which leg would you use?
Right.
Right, okay. Bring this up, bring this up. Anything, back, glutes, hamstring.
You can keep going.
I can keep going, look at that. Okay, so we've got more on this side. We're almost up to 80 on his right side as compared to the left. And once again, the left was the side that you had the history of the tear on, yes?
Yeah.
Perfect, okay. So, could be coincidental, could be something residual, but there is a noticeable difference in hamstring flexibility on the left side as compared to the right. Let's go ahead and test out the SI. So I'm going to bend your knee here. I'm going to bring this across. I'm going to place my hand behind your thigh. I'm going to push on through. Is that okay?
Oh, yeah.
Oh, yeah, he said painfully. Are you sure about that? Oh, what'd you feel?
Feel a little something in that nugget there.
Something kind of in the glutes there as we went forward there. When was the last time you worked out? When was your last exercise day or lower limb day? Glute day.
Every day is lower limb day.
Every day's lower limb day. Okay, so he's a weird anomaly if that's true. But we're going to bring this up, cross, and underneath, and how's that? That's okay?
Just a little dull.
Just a little dull. Okay. Hip range of motion. Bring you up once again. You can get to about 45 degrees of internal on the left. Full available on external. A little bit further on internally, about 50, 55 on this side. All right, good stuff. All right, so my hands are going on your back now, okay, Art?
All right.
All right, so feeling through those SI joints to start. Okay, remember the SI, it's the sacroiliac joint, or where the bottom of the spine connects into the hip bone over here. So, sacrum, ilium, SI joint. Gonna push in through the left side first to start. Is that okay as I press in through there, or does that feel uncomfortable or pain provocating?
No, it feels like it wants to pop.
Feels like it wants to pop. Okay, now how about the other side? Comparing it. Same sensation, similar?
Oh, it feels like that's going to piss myself.
Okay, well that's ideally not what we want to do on the table or on camera. So, yeah.
Gotcha.
Mm-hmm.
I don't have to pee if that makes a difference.
Well, that's you know, if you do, you let me know and we can pause it. That's okay. You okay?
Oh, yeah. I'm pulling my back here.
Oh, sorry about that. We'll use a broader touch. There we go.
Ooh, yeah, it's tight up there.
That is definitely... Okay, so question for you. Are you a deadlifter by chance or no?
Of course.
Okay, so how long you been, when you were powerlifting back in when you were doing it regularly, how often, like what weight did you get built up to with your deadlifts?
My max deadlift?
Yeah, I'm curious.
Like 5 something.
Ooh, okay, this guy deadlifts and he uses his hips properly. But we've got big, what are referred to as paraspinal erectors here, okay? Now, I had this issue where my paraspinal erector muscles, and yes, that sounds kind of funny, but my paraspinal erector muscles ended up getting way bigger as compared to my glutes because I was deadlifting incorrectly. I was lifting with my back rather than the hips. Deadlift is a hip predominant movement, so I was just curious if Art had the same issue as me, but it's also possible that he's just bigger than I am, so. That was my elbow, not him. Yeah, you can breathe as much as you need to here. So what we're doing here is actually a bit of an osteopathic thing. It's called immobilization, okay, where I'm gently just oscillating back and forth at end ranges, trying to induce movement, trying to relax the muscle structures throughout, because Lord knows I feel like he needs it. For you. I'm going to poke through the glutes now to try to find where that tear might have been, okay? Now, I know it's on the left side, but I'm also going to check the right side just to start, okay?
Okay.
All right, so with this, we have 3 glute muscles, guys. We got the glute max, which is the big one that most people are most familiar with. We have the glute med, which has middle child syndrome. They're the ones that hold everything together. But no, the glute med is a director more of a director muscle, if that makes sense, whereas the glute max is more the powerhouse. Then we have the glute min, which just kind of exists and helps on both ends. We also have the piriformis deep underneath them, which mimics the same movement as the glute medius, but we're going to be checking all 3 of those. So first, the glute max kind of encapsulates everything, so even just pressing in, you're going to be getting all of it. The glute med is more of a fan-like distribution, a little bit more to the side. So poking in on the right side to start. Are we okay as I work through here?
Yep.
Awesome.
I think it might have been on the right side, actually.
You're not sure?
It was a while ago.
I guess so. I mean, I don't think I've ever had a serious bodily injury and forgot what side it was on. But it's good to know that you've recovered well, if that's the case. That's a pretty good indicator of a positive prognosis.
Well, I've lost track of left and right.
Oh, well, that's, yeah. I actually never knew the difference to begin with, so I understand that. It's amazing that I'm allowed to drive. So that's tender there, eh? You're allowed to say yes.
It's not the word.
Okay, good.
There, yeah.
That's the spot, okay. So I'm pressing, unfortunately you can't see it from that angle, guys, but I am pressing right into that glute med, kind of what's referred to as the lateral tendon aspect, or the outermost portion of it. Definitely a tender spot on this right. Let's compare this to the left. I'm going to try to do this in a way where my own glutes aren't in the way of the camera there. But, so, okay. Which side was feeling more tender to you, left or right?
Yeah, the right.
The right was. Interesting. Okay, maybe it was the right side. Who knows? We're going to have to go back into the medical history to confirm. That's actually probably a title. Patient can't remember which glute was torn. Is that clickbaity? Guys, let me know in the comments. So we're going to attempt to adjust in through Art's upper back here. Now this might be a bit of a challenge. Again, he has very prominent paraspinal muscles up here, so we're going to be trying to press through those guys. We have loosened them up a bit with the mobilizations we were doing earlier, but let's see if that's been sufficient or not. Take the bracelet off so you can get in the way. Sorry, Nicole. All right, take a big breath in for me, Art, and all the way out. Good. Wow. In. All the way out. Okay. Nothing. Wow. Sometimes people will adjust a little bit, but rarely do we ever get nothing. We're going to have to try this from a different angle in a bit. Alright, so Art's in the right position here. We got the tight arms, and I will actually, you know what? We're going to go like there. Yeah, there we go. Awesome. So, I lied. We're going to go the other way. I can't make up my mind here. So, you need to take a big breath in for me. Big breath out, and little crunch, little crunch, little crunch. Oh, there we go. Got something there. You okay?
Yeah.
Awesome. That worked. Damn. Needs a break. How do you feel?
Yeah, I'm okay.
He's okay. He's with us. He's with us. That's good. A little red. It's okay. That's an intense one, buddy. That's an intense one.
I feel like you got another one in there.
Yeah, it definitely is. And go ahead and pull this. Pull. Good. You know, hold the elbow right there. Nice. Bottom leg straight. Top one bent. Good. Scooch the hips towards me, please. Thank you. Okay. So, going for that low back now. Big breath in. And all the way out. Relax the upper body. There we go. See? Low back went so much easier than that upper back. Damn.
Top went too.
Yeah, nice. Okay, we'll get you on the other side, please. Bottom leg straight for me. Top one bent. I'm going to scooch the hips towards me, please. Scooch the hips towards. Nice. Good. Into this position. Sorry, nope, I'm good. All right. Big breath in. All the way out. Relax the upper body. Nice. Very good. Yeah, those were way, way easier than your upper back. Oh my goodness, night and day. All right, channel, so we're going to be doing the usual that we usually do here. Well, obviously we usually do the usual. That makes a lot of sense, but we're not in the business of doing retakes. So we're going to be starting with the instrument-assisted soft tissue therapy now. He has very, very tight, again, paraspinal muscles, erector muscles, whatever you want to call them. So we definitely want to try to loosen those guys up today. I did adjust through prior to doing the soft tissue work on this, and it was a lot. It was intense, but we managed to get something. Definitely want to add on to that, though. That's why it's always important to approach any one condition from as many different angles as possible to get maximum effect. So, art. Usually when I'm doing this with patients, I give them a chance to kind of talk about themselves. And specifically, I'm actually not giving you the option. You have to talk about your business because I enjoy your business quite a bit, as I have used his services before. I was very happy with them. So Art, why don't you go ahead and share with us a little bit of what you do, which is very fitting of your name, by the way, which I'm sure you get a lot. But yeah. Mm-hmm.
Yeah, thanks. I am a professional headshot and portrait photographer.
That's really cool. So you work here in Oakville, or?
Yeah, I have a studio just on Burloak and Rebecca Street. So I've been there for a few months now, and yeah, couldn't have asked for a better location. Couldn't have asked for better clients. Like it's a great setup.
Good. And what, if I can ask, drew you to kind of doing that? Were you doing something before? Like, were you in corporate and you switched out like every other entrepreneur I know? Or
yeah. I was in tech. So
Okay.
I was working for a startup, and part of the reason why I stopped lifting was because I didn't have the time for it.
Oof.
And so eventually got burnt out working in tech, and one day just decided that's it.
You escaped the 9 to 5 and joined the 8 to 7, huh?
9 to 5, try 7 to 7, dude.
At the startup?
Yeah.
Oh, well, I guess at the startup you're really trying to get it off the ground. That would make sense, wouldn't it? But,
well, East Coast time working for
Oof.
West Coast company, so I'm a morning person, so I start at 7. It's like when I have my coffee and I'm already starting working, like dealing with the residual from the day before, and then that keeps going in because they're 3 hours behind. So when you sign off, they're still going. It was tough.
well, you said goodbye to that. You opened your own little headshot shop, which I highly, highly recommend anybody in the area or out of the area. Make a trip out of it if you want to. But that's exciting. Always exciting hearing entrepreneurs or business owners in here kind of sharing their stories. So thank you for that.
Yeah.
Also include your website in the description down below so that anybody nearby, y'all can check Art out.
I appreciate that. This feels really good, though.
I'd hope so. That's really nice to hear somebody say that this feels good. Usually they say that, you are beating me up. This does not. But it's not, this is supposed to not feel bad. This is supposed to feel good. Now, you are getting quite a bit of redness into this area. I want to reassure you that's totally normal with this intervention, okay? It'll clear up within about 48 to 72 hours.
Explain that to my girlfriend.
Okay, well, you know what? You can send her in here, and I can show her exactly how that happened. Yeah, there you go. You can walk in here, honey, this was the man that did it to me. I swear, and I will say I've never met this man in my life. He's lying, and that'll be the end of that patient-doctor relationship.
Have you done this, Santina?
I don't think I got this.
Not on camera. No, but we have done this. Not to your back, have we? No,
I've
we
never
haven't.
gone.
I've done this to your hand, your
Oh,
tendonitis. Yeah, or
right.
tendonitis. But
Yeah, just my hand, but not my back.
Yeah, this is perfect. Oh man.
you like this, huh?
Yeah, you gonna crack me again after or what?
I can try it again, see if we get anything else if you'd like. Absolutely.
Yeah. That was a tease, man.
That's we're not about teasing patients at Dr. Adam C. Solis Professional Chiropractic Corporation. We're not about that here. You know, we're about we're about full service chiro, physio, osteo. I need coffee. Okay.
I'm just saying things because I know they're gonna get cut.
Oh no, that's buddy. What you don't realize is that my sister, I love her. She's gonna turn that into a reel, and because I don't post my own social media, Santina's gonna put it on social media, and then the world's gonna know. So
Sarah and I are the ultimate tag team.
Oh my god. Yeah. For context, guys, Sarah is my editor and Santina is my social media director. So there you go.
Director. Ooh.
You're something. That's.
I feel like it's just gonna crack when I take a breath.
Huh, that would be probably pretty relieving. Yeah. So yeah, as I was telling Art, we do have quite a bit of redness on his back. Now that is that petechiae that we've seen oh so much on this channel. While it can look quite alarming, especially to common law spouses, as Art is a little bit concerned about, totally normal, completely expected with this kind of intervention, especially with the level of tightness we were having back here. Not anything to be concerned about. In fact, it's indicative of this being an effective intervention for what we're dealing with, specifically the fascial component. So yes, when your girl sees, she will be concerned. You can tell her it's fine. My chiropractor did it to me. That usually actually just makes them more upset. But anyways.
Did not realize how tight I was until you started doing this.
Yeah, a lot of people say that. They're like, I felt great until you started poking me. Well, that's okay. It's my job to find these things. The unfortunate thing is I haven't found a very effective way to do this technique on the glutes, much less on camera either. That's definitely never going to happen. So,
Wear a thong for you.
pardon?
I could wear a thong for you.
It wouldn't be for me, it'd be for the audience. They're the ones who watch this. You think I watch my own videos? It's a lie, I do. It's how you learn.
I can see how this is gonna suck tomorrow.
Hmm?
I can see how this is gonna suck tomorrow.
Oh yeah, some people say that they'll feel more sore afterwards. It's also why I kind of give patients a heads up. Hey, if you are more sore tomorrow, that's actually normal with this. It's not something to be concerned about. I just therapeutically am beating you up. That's like what I'm doing, right?
Yeah.
It's with intent. It's with the intent of releasing the tension we have back here as part of the process. But some mild discomfort can be expected with that. We just finished with the instrument-assisted soft tissue therapy of the paraspinal muscles up in Art's back here. So we're going to retry adjusting through. We did get a little bit beforehand with that anterior adjustment, but we're going to see if we have better luck now that we've calmed down some of the more firm tissues protecting the joint structures there. So, Art, will you take a big breath in for me, please?
Yeah, is the mic rolling?
And all the way out. Yes, mic is rolling. Thank you for checking that. Oh, okay, one more in. All the way out. Not much luck. Once in. All the way out. There we go. Hey! Something! Damn, dude, we're going to have to do some more work on you, but at least, there's hope. Because that's indicative of a result. Now, we noticed at the start that Art has a decrease in his hamstring. I'm going to go down a little bit lower here. Mobility on the left side. All right, so we're going to go ahead and try to stretch that out with our PNF stretching, which we've done a few times on this channel now. So what I'm going to get you to do, Art, is I'm going to bring this leg straight up as far as it can go. All right, so maybe to about... And now suddenly we've got restoration of movement, so I guess all this moving around just helped him out a bit, but that's definitely already higher than it was before. Remember, beforehand we could only get to 45. Now we're looking at like 60. All the same. I need you to drive your ankle down into my shoulder as hard as you can for 10 seconds. Go ahead. 9, 8, 7, 6, 5, 4, 3, and 2, and 1. Relax. And as he relaxes, I'm going to move the hip a little bit further into that flexion. We're going to notice that the hamstring will give more and more weight. Now it's still going to feel tight, but it's that activation and relaxation mechanism that lets us stretch it out a little bit further. So once again, go ahead, drive. 10 seconds. 4, 3, and 2, and 1. Good, relax. And see now on camera, we can see we've gotten it all the way up to 90. So we started today at like 45 degrees limit on the side. And now after some treatment and some stretching, we're up to 90. Let's see if we can go a little bit further. Go ahead, drive 10 seconds. This will be the last one. 5, 4, 3, and 2, and 1. Relax for me. Relax as best you can. Good. All right. So we can get a little bit past 90, not by much, but hey, 80 to 90 is what we're going for. So you do have the range of motion available to you. We just got to work to get it back. That's about it, okay? You need to just slowly lower this leg down. Go ahead, and I'm going to do the same thing on the other side now for you, okay? I'm going to bring this up. And I'm going to get, yeah, there we go. Awesome. All right, go ahead and drive as hard as you can. 9, 8, 7, 6, 5, 4, 3, and 2, and 1. Relax. Good, and drive. 9, 8, 7, 6, 5, 4, 3, and 2, and 1. Relax. Ooh, you okay?
Oh, yeah.
You're good, and drive. Last one.
It's in the calves.
You feeling that in the calf too? Yeah, this will be a hamstring and a calf stretch as we get to the end range. Doesn't help that my chest is kind of pressing into your calf. 3, and 2, and 1. Relax. Good. All right, 90 degrees, same as the other side. So we've got full range of motion available in both the hips. The hamstrings will give the space there. They just need to be worked on a little bit, but well done today. One of our other concerns is his left thumb here. Now, he's been getting some pains, and obviously it's important to get those addressed given that you need to work a camera in your day-to-day, right? Is this getting in the way of your work at all?
Yeah, like adjusting stands and that.
Okay, now for how long has this been going on for? About you can rest that there.
2 weeks.
2 weeks. Okay, and where exactly are you getting that discomfort? Is it on the back? Is it on the front?
It's on the back and it goes sort of like down to the wrist.
Okay, so down to the wrist. Now, are you getting anything up into the forearm at all? No. Okay. Do me a favor. I want you to do this movement slowly. I want you to tuck your thumb into your fist like this. Okay, and I want you to very, very slowly tilt your wrist forward like that. Does that aggravate the chief complaint there for you or not really? Okay, good. So this movement here, and if you're watching at home, I really recommend that you do it slowly. This is something called Finkelstein's test. It's a funny name, I know, but it tests for tenosynovitis, which is inflammation of the tendon sheath itself down here. And with de Quervain's tenosynovitis, which is the name of the brevis tenosynovitis there, takes a long time to rehab better because you can't actually move a sheath, but that's okay for you, right? That's fine?
Yeah.
Good, awesome news. You can relax that then, good. So your discomfort once again is kind of going like this, or is it more, it's specifically in there, so less thumb,
it's
here.
This knuckle, but it kind of like,
Also in through there, okay. So with that, push your thumb up into mine as hard as you can. Does that provoke anything for you?
Yeah.
Yeah, so that little bit there at that joint. Okay, once again, push as high up as you can. Anything, or is that better? Okay. So it wouldn't be a tendon complaint if that's the case, because activation should still trigger that even if I'm supporting the joint structure itself. It's likely a little bit of overuse or strain or something in the joint capsule itself. Nonetheless, something we should be able to treat today. So to get relief when I kind of, that actually just kind of popped a little bit. When I gap the joint like that, does that cause any relief feeling for you or feel like a stretch that you've needed for a while? Yeah, okay. So if that's the case, it seems like compression or irritation in the extension movement of the thumb seems to be the primary aggravant. So let's try to do the opposite of that by gapping the joint and introducing a little bit of flexion movement. Ooh, what'd you feel there?
Yeah, just
felt okay?
A little sharpness.
Little sharpness, okay. So what I'm going to do here is I'm going to get you to lean your body away from me, like whole body, good. I'm going to place my thumb right on top and keep leaning away, Ooh. You okay there?
Yeah.
All right. So that's a stubborn one too. This is something that I would actually want to consider doing acupuncture for. Now, I don't think you like needles. I think we talked about that off camera, so we don't need to do that today, but I want you to file that away for later, because in these small little structures, sometimes it can be best to be very specific with a needle insertion and do a little bit of stimulation there, okay? Because if that's stuck and that's not really moving, well, granted, we did get an adjustment just in when I was initially pulling it. There wasn't much on the second, more intentional adjustment, but that's something else I'd want to consider if it continues to get in the way of your work. Okay, don't worry, Santina doesn't like needles either. Okay, I'm still slowly talking her out of it because she gets headaches, but something to file away for later. Now, up in here, do you get wrist pains proper?
No.
No? All only in that thumb? Okay, we'll keep an eye on that. Again, what I want you to understand with this is that it's not tenosynovitis, which you didn't learn about until today, but now that you know, is a more longer lasting thumb pain, okay? This is something that we should be able to figure out fairly quickly, okay? Art, how did you find everything that we did today?
Good. I feel like we almost got the pops that we were looking for, but I'm aware that probably going to take a bit more treatment.
When was the last time that you saw either a massage therapist, a physio, a chiro, osteopath?
Registered massage therapist?
I mean, ideally someone who's there to work on your back, yes.
Like 2 years ago.
2 years. Okay.
Like it was on a vacation and I'd injured myself.
Okay, fair.
Went to the hotel, but like I don't know.
Okay, so it's been a long time since somebody's worked on your back there. What else? You're getting back into more activity. There was a lag period of getting into that activity, so there's a long period of not being super active. So all of these things combined with stress and the usual day-to-day stuff can absolutely contribute to heavy levels of tension. Now, in your back, I commented many times, very tight. You actually remind me a lot of my own from a couple years ago before I got this under control. You can't always get what you're trying to get, all right? And that's why it's important to go at least a few times. You keep working, you keep on putting impulses through, you keep on getting that therapeutic effect, and eventually we're able to get what would be necessary for a full release. Okay, so I'm confident it can happen. Even today, after we scraped you and then worked on you again, there was more to do. So that shows me that it's there. We're just going to have to keep working on it. I don't actually want to hurt you in the process of the tools.
The scraping was awesome.
Yeah.
Yeah, give me one of those and...
No problem. I'll contact the distributor for you and do a 200% increase in price. But yeah, no. So you liked the scraping though, eh?
Yeah.
You've had that done before. Yeah. When was the last time?
5, 6
5.
years ago?
It's been a long time.
It's been a while.
Eh?
Yeah.
I want to stress to you, and actually you're really smart coming to see somebody now with you getting back into activity, and as you start to increase loads, as I understand you're deadlifting later today, your body's going to be sore, and it's going to fight you back a little bit. That's normal. I can't stress just how normal that is. Seeing someone, either myself or a massage therapist, physio, somebody in the musculoskeletal world can help you avoid, and as you were talking about, decrease and prevent injury in this case. Do you have any questions for me at all about what we did today, what we do going forward?
No, I think we're good. You explained everything.
Awesome.
Pretty
Okay.
well.
Well, thank you.
Yeah.
If that's the case, if you do have any questions, feel free to contact me. Okay, we'll keep in touch. And otherwise, thank you for coming in today. Very much
Thank
appreciated, Art. You have yourself a good rest of your day.
You too. Don't forget to like, comment, and scrape that subscribe button until it's red like my back.
Thank you, Art.